Welcome back to Resilience Real Talk. I'm Dr. Michael Vitellano, and I'm here to talk to you today about a new topic. And we've talked about how families promote resilience, but in this talk, I want to talk more about how members of the community can promote child resilience. So let's start to think about growing up. How many of you attended an after-school organization like a YMCA or a rec center or a Boys and Girls Club? And how many of your children currently attend an after-school program, such as something that the school offers or in the community, like the things I just mentioned? Great, I know that I did, and like I said in the earlier videos, children are not raised in isolation, and so in addition to parents making a difference, there's also teachers and coaches and members of the community that play a role in children's lives.
After-school programs in the community can be helpful in so many ways. They are protective and then they occupy children's time after school, but also prepare them educationally, in both health and behaviorally by being involved in extracurricular activities. So the why in after-school community programs is that they're helpful in that they provide social skills and a place to develop physically and intellectually, but also to feel connected as part of the community. There are role models and social support networks, and a way to really experience and deal with the challenges of becoming an adolescent. So after school programs have been shown to have educational benefits. Kids stay in school longer, also stay out of trouble and are less likely to have troubles with the law, but also sports and mental health outcomes, and also just personal benefits to their self-esteem. And specifically, Boys and Girls Clubs have programs that target substance use, but also attitudes about school, feeling good about school, and keeping kids away from risky behaviors like substance use.
So now I want to talk a little bit about a study that I was involved in graduate school that I wrote with two co-authors about the positive impact of attending a Boys and Girls Club in an inner city community in Knoxville, Tennessee. Shout out Knoxville, and a shout out Boys and Girls Clubs. The co-authors on this study were Paula Feit, shout out Paula. She is now at the University of Kansas and has mentored many young aspiring psychologists and researchers, and as well as Terry Preddy, shout out Terry. She is currently at the Mindwell Psychology practice in New York City. So we were involved in a study that looked at how neighborhood problems, which can be thought of as safety, and attending a Boys and Girls Club impacted a child mood. So specifically, we looked at child depression. And in this study, first I want to talk about the demographics. So the participants were 2/3 African American, 20% white, and then 5% Hispanic, Latino, and 7% other race. And I wanted to highlight that because in child psychology, we do a bad job of representing diverse populations. So if you read the methods of most papers, you'll see that a majority of studies are done on populations that are predominantly Caucasian white. And so this study did really highlighted an underserved community, and how are we to serve these communities if we first don't understand them? So shout out diversity. And the participants were largely under government assistance. So I want to talk a little bit about the findings of the study.
This study was published in the Journal of Community Psychology, and what we found was that the more neighborhood problems or safety concerns there were in a neighborhood was associated with more childhood depressive symptoms, and the children reported on this themselves. Interestingly, we also found that the more frequently they attended the Boys and Girls Club, the lower levels of childhood symptoms were found in those that were attending more frequently. And as expected, delinquency or more rule breaking or law breaking behavior was associated with more depressive symptoms. Now, in this graph, we see that attending the Boys and Girls Club has a positive effect on depressive symptoms, such that children that were attending the club more often, the blue line, had no increased levels of depression based on the neighborhood problems they had. For the children who were attending less often, the pink line, they experienced more depressive symptoms associated with neighborhood problems.
So as you can see, neighborhood problems and program attendance had an impact on child depression. And most interestingly, the number of days that the children attended the program really seemed to provide a safety net. I'd like to think that it has something to do with the relationships between the children and the staff. Staff can be positive role models, and we talked about relationships really being the key of child resilience. Or could it just be providing a safe space for children to go after school, particularly when living in a neighborhood with more problems or more safety issues? Hope it inspired you. If it did, please give it a thumbs up or click subscribe. It helps me reach more families that would like to know more about child resilience and that might not necessarily have the opportunity to see a psychologist. And that was really why I wanted to start this channel for families or parents that didn't have the opportunity to see a psychologist but wanted to learn. So thanks for watching and stay tuned for the next video.